So don't be fearful of procedures. Don't be fearful of the dentist. Don't say that, every dental procedure is very painful. It is not. Most dental surgeons nowadays have got top-end equipment. In fact, we don't even have chairs anymore. We have treatment centers. So don't be fearful of procedures. Don't come with the preset notion that, that the procedure will be started and it's going to be extremely painful. In most cases, it is not.
Welcome to 14th edition of Arogyam Katta. Today we have with us Dr. Jayanto Mukherji, a very renowned dentist of Chembur. He has more than 35 years of experience. Although he has a long experience, he has always kept himself updated with the knowledge. So it's not 35 years. It's much more than that if you look at his knowledge base. Today we'll be asking some basic questions, Dr. Mukherji, for you. But as a patient, I need to understand because I hear words dentist, dental surgeon, orthodontist, and so on and so forth. Are they all same, or is it the difference, or I'm talking about the same human being, or they're different human beings and different species?
Thank you so much, sir. It's really an honor and a privilege to be here with you. Well, coming down to your question, when you say dentist or dental surgeon, basically what happens is that the primary degree that one achieves is Bachelor of Dental Surgery. So every person who graduates from BDS would be defined as a dental surgeon. Now, thereafter, what happens is that when you finish your dental surgery degree, you are qualified enough to do all the procedures in dentistry, but maybe at some basic level. And if you need to super specialize or if you need to qualify beyond that point, then you do a super specialization. So thereafter, if you're doing, say, an orthodontist, is somebody who's done his post-graduation in orthodontia, which deals with, connecting teeth with braces and malalignments. A periodontist will be somebody who's dealing with gum disease. A maxillofacial surgeon will be somebody who's dealing with surgical procedures.
Okay.
Or maybe, if you talk about a prosthodontist will be somebody who's dealing with, the concept of replacing teeth or the science involved with that. But having said that, most dental surgeons with our kind of curriculum are very well equipped to start their practice the moment they graduate, and thereafter probably add on to their skill sets by doing multiple courses thereafter.
Thank you. Now, I remember stories, or I'd come across a survey long back, which said that the question was asked to people, are you more afraid of committing suicide or going to a dentist? And majority of them said we would prefer to suicide rather than going to a dentist. It's less painful. Now, jokes apart, or the reality apart, I now find that the dentistry has changed completely from painful to painless. The other day when my wife's teeth was extracted, and I was waiting outside, and she came in 5 minutes. I said, has he given you anesthesia and waiting for that? How long we have to wait? But she said, no, it's done. I said, I didn't hear any scream. So it was that pleasant experience. Now, how did it happen from, notoriously known to be painful to completely painless?
So in the words of Ogden Nash, he had said that there are some pains which are physical, some which are mental, but a combination of those two are dental. That was of course, somewhere in the 1800s and 1900s. The advent of anesthesia, local anesthesia, and also sedation has dramatically altered this whole concept of dentistry being, something to be feared and something which is extremely painful. Now, unfortunately, what's happened is that most people are still stuck with that the
Old,
old image of what dentistry used to be all about, how painful it was. But nowadays, with newer techniques, with newer procedures that we use, with newer anesthetics, the anesthetics that we use nowadays are highly lipid soluble. So what happens is that with the procedure, when you're doing the procedure, the onset of anesthesia is so fast that traditionally what used to be happen that you have to wait for an X amount of time before the anesthesia kicked in, and then you have to do the procedure. Local anesthetics nowadays are extremely potent. They're extremely quick in their onset of action, and they have a long depth of anesthesia. So the profoundness of the anesthesia is a lot more.
okay.
So when that happens, and when the person basically is not feeling any kind of procedural pain, the level of anxiety automatically drops.
Down.
And there's something about doing the subconscious also. So when the first step, when the first procedure, which is the most feared, the injection, that procedure itself is completely painless, primarily because of the fact that we use silicone coated needles and we do a pre-anesthetic application. So once we do that, the whole procedure is a lot less painful as compared to what the patient has envisaged in their mind. Right. Thereafter, things become a lot more easier. Of course, for people who are morbidly afraid of taking an injection, we do have techniques of chest sedation. We can use nitrous. We can work with sedation in the OT. We, of course, in our country, we are not allowed to sedate on the chair because it's not still under the legal umbrella. But we can do the procedures with sedation in an OT, and most of the times, it is very well managed.
Oh, great. Now, why can't your association put in some efforts to sensitize people that dentistry is no more as bad as it was? Probably you'll have to work with your association because you will find a lot of patients like me who are afraid of, or we keep postponing by years to visit a dentist. Probably we can get tempted to at least show our teeth to a dentist.
So I think the sensitization will not happen only with going through an association. I think it is also the duty of the practitioner or the dental surgeon to be a little bit more approachable. Unfortunately, I don't know. I mean, I speak from whatever experience I've seen that doctors sometimes do sit on a pedestal. They don't want to explain things before they start the procedure. I believe that a dentist also has to be a psychologist. So you have to explain the procedure, you have to sensitize the patient and, allay their fears. Basically address their fears and allay their fears. It's not that, you have to start the procedure from day one. Okay. Let the first sitting, let the first appointment be a counseling plan. Walk them through the procedure, explain the whole thing to them. So once they have a clearer picture, it becomes a lot more easier for them to accept what is going to be done, by virtue of which they automatically allay their fears. So typically in my practice, I would never inject a patient on the first sitting. I would do something which is non-invasive, maybe shoot an X-ray, maybe do a counseling, maybe do something which is not painful, give some basic first aid care, and then in the subsequent sittings, inform the person with every step that you're going to be performing. The moment that is done, it automatically cuts down the anxiety levels by half. And thereby, a person is a lot more receptive and a lot more perceptive also of the whole treatment.
We hear the word digital India, digital X-ray, digital, everything digital now. What is digital dentistry?
So, sir, the thing is, there's a progressive shift happening now from analog dentistry to digital dentistry, whereby, we integrate a lot of AI.
AI has entered there also?
AI has entered dentistry big time and in a big way also.
I see.
So augmented reality, simulations, and then, basically when you're using a lot of artificial intelligence to explain, to kind of do your diagnostic capabilities. So it divides into two segments. You do diagnostics with your AI, and machine learning will automatically augment what the eye can see. Okay. So if you're doing X-rays, if you're doing digital X-rays, if you're doing digital radiography, It will automatically augment, the images, something which the probably human eye might miss, will be augmented by machine learning by AI.
Mm-hmm.
Now, when that happens, what happens is that your diagnostic capabilities become a lot better.
Okay.
Also, because the diagnosis is better, automatically the treatment planning can also get better. And even within the treatment planning, you can incorporate a lot of AI to do simulation planning.
Uh-huh.
So you do like a simulation treatment. You do kind of a basic surgical planning also. For example, if you're doing implantology, we can do planning for a guided surgery using AI, using simulation, which again is a kind of a patient education tool too.
Okay.
So what happens is that when you're using these parameters or using these guidelines, it makes the treatment a lot more easier. It makes the treatment a lot more seamless, and to a large extent, idiot proof also.
Mm-hmm. I had heard about laser treatment in dentistry about 20 years back. But of late, I don't hear about the word laser technology. Is it a matter of history, or is it so advanced or so common that nobody talks about it?
Well, I think so it's both the latter. Because lasers have been inculcated and involved so much now into the dental practice that it's not a novelty anymore.
Okay.
So you have different kinds of lasers. You have hard tissue lasers, you have soft tissue lasers. Now, with hard tissue lasers, you can do like a plethora of action. You can use the lasers for doing biostimulation. You can do biopsies. You can actually do cavity preparations also, hard tissue preparations with lasers. The soft tissue lasers can be used for something which is called as LLLT, is low level laser therapy, and also something called as LANAP. LANAP is laser activated new attachment protocol. So lasers are basically working within that range which deactivates bacteria and which deactivates and promotes tissue healing. Automatically, what happens is that it stimulates growth, it stimulates repair, and because it stimulates repair, the outcome is a lot more faster. The outcome is a lot more predictable, and it's far less painful to the patient as compared to say a conventional surgical approach. But having said that, there are limitations in lasers also. One needs extensive training. Laser equipment is expensive still, and one needs to know exactly what are the applications of the laser, where they can be utilized and where they can't be.
Are they used in root canals also?
Yes, sir. So root canals, they use it for photonas. Lasers are used for deactivation and disinfection of the root canal system. Because the moment you expose the light source, they expose the laser source within the canal, it deactivates and it nullifies the bacterial growth within.
Okay.
How much of it is used on a regular basis in the Indian scenario, in the Indian setting? I mean, I'm talking the Indian setting. It's used extensively abroad. But how much of laser deactivation in the root canals is used in the country is still not documented. So we don't know how much. But soft tissue procedures and hard tissue procedures are being regularly done with lasers.
Now tell me, as I see that private dental surgeons or private dentists or whatever you call it have advanced in their technology, has gained a lot of new equipment, new machinery. Now, are the government, I mean, for poor, underserved people, normally go to government medical colleges or government dental colleges. Do they have the same facility that you offer, or they have a different kind of basic treatment? When I'm talking government, it's municipal, charitable, so and so forth. I mean, it's not only GDC or government dental college. It's for NIR and so many of them.
I'm not really in a position to answer that suitably well because I have not visited a college facility for a long time. But having said that, I do believe that a lot of equipment, a lot of machinery, a lot of advanced machinery also is now being incorporated within government organizations also. I know for a fact that semi-private dental colleges, which also don't really charge too much, or which are not really prohibitively expensive for patients, have a lot of cutting edge technology and instruments within their firmament. Now, how many people are actually trained on that is again a matter of debate. But the thing is that the technology is there, and if the technology is present, and it is eventually going to be the norm. If the technology is present, I do feel that like it is going to filter down to the common masses also. Like most of these equipment nowadays, if you see like a digital scanner, or if you see like a handheld X-ray device, are portable devices.
Correct.
It's something which you can just probably put in a laptop bag and carry it with you. So you don't really need to do physical analog work anymore. A lot of work can be digitized, and that digitized work can be done from any point. All you need is a power source.
I see. Now there is 3D printers are also like AI, digital technology. 3D printer technology has also emerged as one of the major game changer. Now, has the same thing happened in dentistry too?
Well, so 3D printing is being extensively used in dentistry nowadays. So we use 3D printers for, again, like I said, for diagnosis, wherein we can take STL models, which is stereolithographic models, which can be used for education, which can be used for simulation treatment, which can be used for educating, and also kind of doing planning and planning a procedure. So 3D printers have been in the use in dentistry for a good 10 years now. And there are certain companies like Asiga which make extremely fast 3D printers. And the quality of 3D printing has dramatically improved over the last couple of years. Dramatically. So we don't really use, you can print crowns, you can print models, you can print even implant processes. Probably a tooth also. You can print everything under the cloud. So whatever can be put up in the cloud can be printed and can be delivered as a process. It's been being extensively used for crown and bridge processes. It's being extensively used for implant-driven processes because the accuracy, the fit is far much superior. It's far superior to an analog impression. So that margin of error that you might have with an operator working with an analog procedure is hugely negated when you use a digital process. And the fit, the final finish of the processes, the applicability, the long-term durability is dramatically improved. Dramatically improved.
Now, coming to the last question, good, so many developments, so many things. What about the cost? I mean, I believe dentistry has become very expensive.
You've touched a nerve. Actually, you touched a raw nerve. In the truest sense of the word. So dentistry, I mean, it's like the house that Jack built. If you have to incorporate technology, there's a cost factor involved because nothing comes cheap. If you are buying, if it's like, I mean, to draw an analogy, if you buy an Alto and if you buy a Rolls Royce, there is a difference in the cost.
Maintenance.
So the point is that if you're going to be inculcating high-end technology, there's going to be a high-end price. If there has to be a return of investment on that high-end technology, which of course is making the treatment a lot more easier, there is going to be a filter-down effect. There's going to be a trickle-down effect. The point is that with more and more application, with more and more, with higher amount of production and with more accessibility and acceptability, the cost factor eventually will come down.
Yeah, but today it is not.
But today it is.
So typically, suppose the implant costs about 50,000. Now, does that include the 3D printed tooth, or is it still analog?
So typically, what happens is that when you're talking of an implant processes, it would. I mean, normally when the quotation is given, say for an implant processes, it includes the implant placement, the surgical and the prosthetic component, which means the implant placement and then the final crown on top. Now that's an entry level thing, so at that given point of time, you can ramp up depending upon what is required. Most people in India neglect their hygiene to a point, or the oral hygiene to a point that you need a lot of secondary procedures also. So, for example, I'm just talking about implants over here. If you're doing an implant with a crown in healthy bone, you probably have X amount of rupees which is being quoted. But if you're going to do an ancillary procedure, suppose the bone or the substrate is not adequate,
Strong enough.
and if you do any kind of ancillary and additional procedures, and if you're going to be using biomaterials, or if you're going to be using your skill sets also, then there is an additional cost factor attached to that. So, so it's very difficult to really put a price on a procedure nowadays. It all depends upon what is customized for the patient. And when it's customized, a customized cost differs from a say, of the rack rate. So the rack rate is different, and the customized.
What could be the variation? If say 50 is the norm, I mean, I know there are dentists charging from 30,000 to 1 lakh rupee for implant.
There is a wide variation.
But suppose that, let's say 50,000 is the, and you need to do, it's a completely complicated. That 50 will become 2 lakhs, 50 lakhs, 1 lakh, 80,000. I mean, some kind of
again,
frame.
Again, it's like I said, it's very difficult to really place.
No, it's a kind of what we call is a budgetary.
A ballpark estimate would be that if you're going to be doing an augmentation procedure, like a complex augmentation procedure, or if you're going to be doing something which is better than what you have from like a conventional delivery, it would sometimes be anything between 1.5x to 3x of the treatment cost and planning. So depending upon what kind of biomaterials are used, depending upon what kind of procedures done, what kind of ancillary procedures are done, how many consultants are involved in it. Because sometimes you have to also get in additional consultants to do the procedure. So all that kind of adds on to the cost factor.
So a good modern dentistry is still very expensive, but of course the cheapest in India, because we see a lot of people from US coming to India just for tooth extraction or tooth implant or whatever. I'm told in US it starts from 10 lakh rupees. I don't know what the actual position, but tooth extraction is anywhere between 2 lakhs to 3 lakhs, just the extraction and its restoration. So anyway, thank you for having come to Arogyam Katta.
Thank you so much.
And answers all the questions.
Real pleasure. Thank you so much.
We will be asking you, I'll be asking you some rapid fire round questions, answers of which will be yes or no, or very briefly. I mean, we don't need a long explanation.
Absolutely.
Just briefly. Okay.
Yes, sir.
Now, do you have to say anything before we close to the audience or to your viewers from your side as a doctor or as a dentist or as a dental surgeon?
Well, I have always believed that prevention is better than cure. So the best thing to be done, the best rule to follow is that seek treatment when there is no problem. The moment you're seeking treatment when you're having some kind of pain or some kind of discomfort, it means that it's already tipped beyond the balance. Dental conditions are normally very innocuous. They're literally practically painless in the initial stages. So if early assessment is done and if early kind of follow-up is done, it can nip the problem in the bud before it becomes something more complicated. So don't be fearful of procedures. Don't be fearful of the dentist. Don't say that every dental procedure is very painful. It is not. Most dental surgeons nowadays have got top-end equipment. In fact, we don't even have chairs anymore. We have treatment centers. So don't be fearful of procedures. Don't come with the preset notion that that the procedure will be started and it's going to be extremely painful. In most cases, it is not. If you are approaching like in any other medical field, if you have a cardiac problem, if you're approaching in the early stages, it can be done with minimally invasive techniques, minimally invasive work. Always approach when you have no problem. Because the moment you are facing problems and if you're approaching, that means it's already gone beyond a point of repair. So please seek prevention. It's always better than a cure. Thank you.
Thank you very much for coming.
Thank you so much, sir.
And let's hope we have more sessions like this.
Absolutely.
Thank
My
you.
pleasure. Thank you so much.
Doctor.
Thank you.
Doctor, as we close,
Yes.
I'll ask you some rapid fire round questions.
Absolutely.
Answers of which will be yes or no or very briefly.
Okay.
Okay. Now, digital dentistry is the future of dental practice.
Absolutely.
AI has the potential to fully replace human judgment in dentistry.
Not completely.
3D printed dental implants are as stable or as reliable as the normal ones.
Probably questionable.
Laser dentist is pain free.
Not entirely.
Teeth whitening can damage enamel.
In the hands of an untrained professional, yes.
Real aligners are as effective as the traditional braces.
They are an adjunct, but not yet completely replaceable.
Fluorides is still the essential for dental health.
To an extent, yes.
Gum diseases can be reversed with proper care.
Absolutely.
Same-day crowns are as durable, as strong as the traditional ones.
Yes, they are.
Dental anxiety is very common in patients.
I fully agree.
A chipped tooth can be repaired.
Yes, given the clinical scenario.
Electric toothbrush or water flosses are better than the normal routine flossing or brushing.
They're an adjunct.
Digital x-rays are safer than traditional x-rays.
Yes, they are.
Poor oral health can affect your overall health.
Absolutely.
Mouthwash is necessary for a good oral hygiene.
It's an adjunct, but it's not a replacement.
I'll ask in Marathi because hope you understand Marathi. लहान मुलांचे जे दात ज्याला दुधाचे दात म्हणतात त्याची क्वालिटी किंवा त्याच्यावर काम करणं जरुरी आहे का कारण ते पडतातच शेवटी.
इनफॅक्ट ते जास्त महत्वपूर्ण त्याचंच आहे कारण दुधाचा दात समजा काय प्रॉब्लेम झालं तर त्याच्यानंतर जे परमनंट दात येतात त्याच्यावर ते इफेक्ट करणार. तर दुधाचा दात इनफॅक्ट आर मोर इम्पॉर्टंट दॅन द परमनंट टीथ कारण त्याच्यामुळे काय होतं की मुलांचं समजा न्यूट्रिशन समजा ते त्याच्यामध्ये प्रॉब्लेम आहे तर लहान मुलाचं न्यूट्रिशन पण इफेक्ट होतात. आय थिंक इट्स मोर इम्पॉर्टंट टू मेंटेन मिल्क टीथ than permanent teeth.
Thank you very much.
Thank you so much.
If you like the video, please subscribe to our YouTube channel, Arogyam Katta, where we bring you insightful interviews with doctors from various specialties. Stay tuned for expert advice and valuable health information.